Okay po. Our attendees can now see the platform. We will just wait for a minute po to accept. Thank you.
Cavite State University, or CVSU, started as a pioneer Indang Intermediate School in 1906. Since then, the name of the school went through several changes. Indang Farm School in 1918 and Indang Rural High School in 1927. In recognition of the contributions of Don Severino de las Alas to the community, to the province of Cavite, and to the country, the school was named Don Severino National Agricultural School in 1958. In 1964, the school was converted into a state college called Don Severino Agricultural College, or popularly known as DSAC, by virtue of Republic Act 3917. Finally, on January 22, 1998, DSAC was converted into Cavite State University. CVSU is strategically located within the historic town of Indang, Cavite, which sprawls on 76.6 hectares and is the administrative seat of the whole CVSU system. The Don Severino de las Alas campus, which is the main campus located in the municipality of Indang, maintains 10 colleges, offering 108 undergraduate, 28 graduate, and 13 non-degree programs. The College of Agriculture, Food, Environment and Natural Resources, College of Arts and Sciences, College of Criminal Justice, College of Economics, Management and Development Studies, College of Education, College of Engineering and Information Technology, College of Nursing, College of Sports, Physical Education and Recreation, College of Veterinary Medicine and Biomedical Sciences, and Graduate School and Open Learning College. CVSU prides itself being the center of excellence in agriculture. Academic programs are regularly submitted for accreditation by the Accrediting Agency of Chartered Colleges and Universities in the Philippines, or AACUP. Of the 92 accreditable programs, 42 have Level 1 status, 22 with Level 2, and 11 with Level 3 status. The BS Agriculture program is so far the only program with Level 4 status. True to the university's mission of developing globally competitive individuals, it has been consistent in producing top-notchers, obtaining 100% passing rate and above the national passing percentage in different licensure examinations. Students have high degree of exposure through the on-the-job trainings and other related activities here and abroad with its international linkages. The university continues to serve foreign students enrolled in different programs who come from Asia Pacific and Oceania, North America, Africa, and neighboring Asian countries. Faculty members perpetually strive for excellence by pursuing masters and PhDs under the Faculty and Staff Development Program, while others are enjoying scholarships from government and non-government organizations. Exposure to national and international fora, seminars, trainings, and workshops is a way of life for faculty and employees to ensure quality output and top-of-the-line delivery of services to its clients. Through the years, CVSU has established satellite campuses through Memorandum of Agreement with the local government units, or LGUs. Two campuses, the Cavite College of Fisheries in Naik and Cavite College of Arts and Trade in Rosario, were integrated to the university by virtue of CHED Memorandum number 27, series of 2000. To date, it has 11 satellite campuses located in different municipalities and cities around the province, such as Bacoor City Campus, Carmona Campus, Cavite City Campus, T3 Campus composed of Tanza, Trece Martires City, and General Trias City campuses, Imu City Campus, Silang Campus, and the latest addition to the family, the Maragondon Campus. The CVSU system is headed by the University President, Dr. Hernando D. Robles, who is in charge of the overall administration and supervision. Working hand in hand with the University President are the 5 Vice Presidents. The university has been in the forefront of continuously conducting and producing quality researches and innovations in various disciplines. The research agenda of the university focus on 5 thematic areas on which the research and extension activities are anchored: agri-fisheries and food security, biodiversity and environmental conservation, public health and welfare, smart engineering, ICT and industrial competitiveness, and societal development equality. The integrity and credibility of researchers gained the trust and confidence of national and international funding agencies to invest in the conduct of different researchers. Likewise, researchers are given the opportunity to present their papers in local, national, and international arena, and are even encouraged to publish their research outputs in national and international refereed journals. Innovations, new technologies, creative outputs, and intellectual properties are also protected through patent applications. Since 2008, CVSU is the base agency of the Southern Tagalog Agriculture, Aquatic and Resources Research, Development and Extension Consortium, or STARDEC, a consortium fully supported by the Department of Science and Technology, Philippine Council for Agriculture, Aquatic and Natural Resources, Research and Development, or DOST PICARD. CVSU has maintained the National Coffee Research Development and Extension Center, or NCRDEC, that spearheads the planning, establishment, and maintenance of the Coffee Agro-Eco-Tourism Project and produces coffee seedlings and processed coffee products. The university is all out in providing services through the conduct of technology and livelihood trainings, as well as technical assistance for community members. CVSU is also one of the identified partner agencies of the Agricultural Training Institute, or ATI, Region 4A, in its implementation of the Techno Gabay Program, or TGP, in Calabarzon. Through the extension services of the university, ATI gets assistance in establishing Farmers Information and Technology Services, or FIT Center. In a memorandum of agreement signed by the university president and the provincial governor, CVSU has now established the Cavite Water Testing Laboratory, aimed at monitoring the quality of groundwater and surface water to safeguard water security and improve the well-being of Caviteños. The university maintains its various services, sustains its operations through income-generating projects, and manages pure business enterprises. CVSU is also generating considerable income from its flagship product, the Aguinaldo Blend, a major coffee product made from the combination of 4 varieties of coffee: Robusta, Arabica, Excelsa, and Liberica. CVSU's Peak of Transformation highlights the ongoing aggressive infrastructure development to position the university among the top universities in the ASEAN region. The establishment of Agri-Eco-Tourism Park is another attraction that would surely boost the income of the university. It is a farm and ecology-based project that will showcase the existing resources, designed to highlight new technologies and boast the natural beauty of the university. Likewise, the construction of CVSU International Conference Center will pave the way for local, national, and international functions and events. Hostel Tropicana is second home to local and international guests and visitors, while enjoying their stay in the university, especially during seminars, trainings, conferences, even business and social gatherings and other activities. It is also an ideal venue for different functions, relevant to the operations of the university and a training ground for undergraduate students of related discipline. Clear to its vision and mission, CVSU was hailed as the top performing state university by ACO in terms of quality assurance, ensuring students of globally competitive programs. In its continuous and concerted effort as it moves forward in one direction, CVSU is now ISO 9001:2015 certified. For 4 consecutive years, CVSU is still the champion, being awarded as the most outstanding state university in gender and development implementation in Calabarzon, a recognition accorded by the Regional Development Council, or RDC. CVSU is currently in transition of strengthening its educational standards, shifting from output-based to outcome-based quality assurance and facing the new challenges of K-12 issues and concerns. Now, facing the challenges to be a global university, CVSU remains to be Level 4 State University in Calabarzon in SUC leveling. For more than a century now, Cavite State University continues to defend the tenets of truth, excellence, and service, vows to uphold its vision and mission, and affirms its commitment that in the next years to come, it will be too fast and too serious in transforming the university into a global university through academic breakthroughs, outstanding researches, remarkable extension services, and updated facilities worthy of global recognition and commendation.
Hello, everyone. Good morning, good afternoon, and good evening. Welcome to the 6th series of international nursing webinar entitled Understanding Health Behavior and Application of Theories in Research Among Older Adults. This webinar is in collaboration with the Filipino Nursing Diaspora Network, the Cavite State University College of Nursing, and the Cavite Provincial Health Office, especially the General Emilio Aguinaldo Memorial Hospital located at Tres Martires City. My name is Nurse Rolando Pascual Antonio from the College of Nursing, and I am one of your hosts and in charge of the program, live from Cavite, Philippines. Together with me is my co-host, Mandori, a faculty member from the Department of Medical Technology. Hi, Ma'am.
Hello, Sir Rolly. Good morning. Good day, everyone. I guess all of us here in the platform are all excited today's webinar. Meanwhile, Sir Rolly, for the information of everyone, at present, we have a total of 422 participants joining us in this webinar.
Well, I am pleased to hear that. Thank you, Ma'am Dory, for the updates. And to officially start the webinar proper, let us ask and feel the presence of our Heavenly Father through a short video prayer, followed by the Philippine National Anthem. Please be informed that this webinar is recorded and the recorded session will be posted on the Facebook page of the Filipino Nursing Diaspora Network. And to commence with our webinar, let me read a few online etiquettes for today's activity. We would like to advise and encourage our attendees and other participants as well to look for a conducive place with a stable internet connection to avoid unnecessary interruptions. Likewise, you may use the chat box section to raise your concern or questions, and this will be entertained later, right after the presentation of our invited resource speaker. Now let's hear from Dori.
Okay, so at the end of the webinar, we will be sending the link of the webinar evaluation form. We will highly appreciate if you will fill out and complete the data needed in the evaluation form. All feedback, comments, and suggestions that we will receive will be considered for the improvement of our future webinars. To start with our program, let us hear the welcome message from the Dean of the College of Nursing at Cavite State University. Ladies and gentlemen, let us all welcome Dr. Evelyn M. Del Mundo. Good day, Dean.
Thank you, Ma'am Dory and Sir Rolly. Hello, greeting to all. It is my great pleasure to welcome you all here with us in this webinar entitled Understanding Health Behavior and Application of Theories in Research Among Older Adults. To our university president, Dr. Hernando D. Robles, to Dr. Camilo A. Polinga, our OIC president and the vice president for administrative and support services, to our vice president for academic affairs, Dr. Maria Agnes Pinuestro, Dr. Melbourne R. Talaktak, our VP for research and extension, and Dr. Marilyn Escobar, VP for Planning and Development. To the President, CEO of Filipino Nursing Diaspora Network, Professor Violeta Lopez, Dr. Cindy Lay, Director for Professional Development, FiND, and to Dr. Jerome Babate, Secretariat, FiND Society, good morning to all. To our respected guest speaker and two guest reactors who will be formally introduced later, all deans, faculty members, and staff of the Cavite State University and from the different schools and colleges of nursing, to all nurses and other professionals from different hospitals and institutions, colleagues, students, and other stakeholders present in our virtual platform, a pleasant day to all of you. This event is part of our webinar series of Filipino Nursing Diaspora Network and Cavite State University College of Nursing Partnership. With great gratitude to another chance given to us by our collaborative partner, the Filipino Nursing Diaspora Network, for the 6th time. Our deep appreciation to our based hospital, General Emilio Aguinaldo Memorial Hospital or GEAM in Trece Martires City for accepting our invitation in this exceptional time of being in a new normal situation. Today, we can obtain an in-depth knowledge about older adults' complex medical, social, and care needs, better understand their health-seeking behaviors, and bridge the identified needs through application of theories in research. let us take this opportunity to listen to all our respected guests and reactors. Let's carry on the responsibilities of staying healthy, continue doing activities to maintain good health, to prevent ill health, as well as dealing with any changes from a good state of health. Again, we welcome you all as participating members of our educational community and appreciate your time and effort in being with us. I am wishing you all an interesting day. Again, a very warm welcome to each and every one of you.
Okay, thank you very much, Dean, for your warm welcome message. To continue with our program, Sir Rolly. Sir Rolly, naka-off po kaya?
At this point, may we call in the College of Nursing Quality Assurance Accreditation Coordinator, Professor Sunny Rose Ferreira, for the opening remarks. Good day, Sir Sunny.
Good day to each and everyone. So again, good morning to everyone. And again, we'd like to acknowledge those people who are responsible for making this happen, our 6th webinar series. And to our Dean, we would like to thank you for leading again our webinar. And of course, special thanks to the FiND network for providing us with partnership so that we can accomplish all of this task. So we have been at a point in our life that we were not able to prepare for such a time like the pandemic that had hit us starting with the early 2020. So with all of this, we found hardship. We found challenges, just like attending webinars, which were then seminars. Because it's now online, we changed the S to the W, and we are doing all of this in the virtual platform. With the current predicament that everybody all around the world have experienced, it had taken toll on our physical, emotional, mental, social, and even the spiritual well-being of everybody. So much more to the vulnerable groups of the very young and the very old. How did they cope and manage their health in trying times? That then is the question. So being faced with challenges in health, from a simple cold, a chronic illness like cancer or diabetes, or a communicable disease, we now need to understand how people react and behave accordingly based from numerous influences and experience that led us to our situation. For us, medical professionals, nurses, and the others, it is now very important to fully understand how health behavior is formed so that we could be more of a helping hand and a carer to our people. So this morning, again, we would like to thank your presence, the 400 plus attendees, and hopefully that this day would be a fruitful one and we would be able to be again of great help and be a better carer for humanity. Thank you very much and good day to each and everyone.
Thank you very much, Professor Sunny Rose Ferreira. And now to highlight the webinar objectives, let's hear it from Ma'am Dory.
Thank you, Sir Rolly. So this webinar is intended for nursing researchers, faculty of the College of Nursing and Health Sciences, student of allied health, nursing staff, and employees working in public health, educators, and other interested professionals. Moreover, today's webinar has three specific objectives. First, describe health-seeking behavior of older adults. Second, discuss health behavior tourists and its impact on healthcare decision and health-seeking behavior of older adults. And lastly, build strong alliance and strengthen partnership of the College of Nursing linkages among external healthcare and international academic organizations.
At this level, to formally introduce our resource speaker, may we call in Nurse Ivan Derek Waikoko, faculty member of the Cavite State University College of Nursing and the coordinator of the Filipino Nursing Diaspora Network. Also, he is a member of the board of director of the Philippine Nursing Research Society Incorporated, Cavite Cell. Good day, Sir Ivan.
Thank you. Our resource speaker is a full-time assistant professor at Kennesaw State University Wellstar School of Nursing. She obtained her Doctor of Philosophy in Nursing from Georgia State University, her Bachelor of Science in Nursing and Master of Arts in Nursing degrees from the University of Santo Tomas. She has worked in the field of aging for almost 20 years. She has a broad range of experience, including education and experience in nursing, leadership and management, research and evaluation, curriculum development, working with older adults and families, and direct patient care. Her primary research interests are minority health, health disparities in aging research, family caregiving, and dementia. She focuses on understanding the behavioral processes associated with aging and the factors affecting their healthcare decisions. Her work aims at developing culturally tailored interventions for minority aging populations, involving their families and social support to improve their quality of life. She also has special interest in advanced analytic techniques to model data in large scale, longitudinal, and dyadic studies using big data. She has presented nationally and internationally and published several journal articles related to aging and health behavior. She is an innovative educator, a transformative leader, and an advocate for research on promoting healthy aging, positive health behavior, community engagement, and health literacy. She received the Georgia Asian Times Valiant Awards in 2019. The Philippine Nurses Association of America awarded her the 2020 Excellence in Research, and the National Hartford Center for Gerontological Nursing Excellence recognized her as a distinguished educator in gerontological nursing in 2021. To discuss understanding health behavior and application of theories in research among older adults. Let us welcome our resource speaker, Dr. Mary Joyce Ramos.
Thank you, Ivan, for the introduction. Oh, I'm hearing a little background. Okay, so good morning, everyone. Good evening here if you're in the United States, and good afternoon somewhere where I don't know where you're coming from. So hello, everyone. So I'll be discussing today understanding health behavior and application of theories in research among older adults. So I just want to give you my full disclosure over here, I have no financial disclosure or conflicts of interest with the presented material in this section. These are just my own, so I'm not representing anybody. So for participants, the 422 people listening right now, you can put in your chat what brings you here today and what are you hoping to get out of today's session. So for what brings you here today, hopefully you're not being forced by faculty members. So you can put in the chat in there. Let me see what's people respond. Okay, some. Yep. Yes. Just waiting for a minute in case anybody want to put in the chat box in there. What brings you here today? Okay, well, probably people are still contemplating the latest and trends in nursing profession. Oh, Sir Ivan brings me here today to learn more about older adults' health-seeking behaviors. So, yep, we'll probably have some of those answered later on as we progress on our discussion for this morning. So, my agenda for today, what are the topics? The first one, of course, older person's health. I'll provide you some statistics, recent statistics specifically on COVID cases we'll put in there, and then some of the metrics that we use on checking on some epidemiological side for older person's health. And then also I'll mention some of the health behavior theories, not all of them, but some, probably I wouldn't say my favorite, but the ones that I use for my research. And then how I apply these theories in my research scholarship, my teaching scholarship, and professional service. So that's just the breakdown of what I'm gonna capture for the discussion. So let me start with Healthy People 2020. So for Healthy People 2020, so let me have you the picture over here. So since 1980, the United States Department of Health and Human Services has released at the beginning of each decade a new set of science-based national objectives with 10-year targets to achieve by the end of that decade. So these national objectives are part of the Healthy People Initiative. So one of the longest spanning disease prevention and health promotion initiatives in the United States. So Healthy People provides a strategic framework for promoting, strengthening, and evaluating the nation's efforts to improve the health and well-being of all people. So its specific measurable objectives serve as a national agenda for eliminating disparities and advancing health equity. So the initiative tracks data-driven outcomes to monitor progress and motivate, guide, and focus action by individuals and entities at the national, state, and local levels. So if you will look at the picture on the left side, it starts in 1970 when there's a Clean Air Act, and then the eradication of smallpox. So in 1980, their objective was decrease the mortality from infants to adults and increase independence among older adults. And then in 1988, so they declare nicotine is addictive during that time. So one of the, well, for their next objective for 2000 during the 1990 is to increase span of healthy life, reduce health disparities, achieve access to preventive services for all. So, and then in 1990s, what happened? So they have like fluoridation of like the drinking water, one of the major issues in 2000s in the United States is actually obesity and chronic disease. So based on these issues, they focus on their 10-year objective for 2010 to make it to attain high quality, longer lives free of preventable disease, achieve health equity, eliminate disparities, create social and physical environments that promotes good health, promote quality of life, healthy development, and healthy behaviors across life stages. So that's kind of, if you will notice in the objectives, there are more and more each decade. And then what happened during 2005, as you can see, there's Hurricane Katrina happened in the United States, and H1N1 came in 2009, and many people were scared during those times. So they set the Healthy People 2030 for 2020 to attain healthy, thriving lives and well-being, free of preventable disease, disability, injury, and premature death. And basically, you can just like check on some of the things, eliminating, achieving health equity, attain health literacy to improve health and well-being of all, create social and physical and economic environments, promote healthy development. So having this type of objectives, it means there should be more metrics in place and there should be more programs to achieve this objective. But what happened? So in 2020, COVID happened. And as of today, the latest data for coronavirus cases is 505,403, and the death toll is 5,135,387. And so far, almost 231 million recovered. So they, even before COVID happened, they established the Healthy People 2030. So for Healthy People 2030, as you can see, their vision over here is a society in which all people can achieve their full potential for health and well-being across the lifespan. And to achieve that vision, there should be overall health and well-being that can measure based on 8 broad global outcome measures. So there are so many measures, and if you will look on the left side, the core objectives, there are 355 measurable public health objectives that have 10-year targets and are associated with evidence-based interventions. And there are small subset of 23 health indicators to achieve or to assess and to measure those the health and well-being to achieve that vision for 2030. So for those leading health indicators, when you look at the left side of the screen over here, so for all ages, they focus on children, and then 2 years old and up, speaking of like oral health care, consumption of calories from added sugars, drug overdose deaths, exposure to unhealthy air, homicides, household food insecurity and hunger, persons who are vaccinated annually against seasonal influenza, persons who know their HIV status, persons with medical insurance, and then suicide. And if you will look at the far right down over here, so the older, the adults and the older adults, so adults engaging in binge drinking of alcohol, adults who meet current minimum guidelines for aerobic physical activity, adults who receive colorectal cancer screening based on the most recent guidelines, adults with hypertension whose blood pressure is under control, cigarette smoking in adults, employment among working age population, maternal deaths, and new cases of diagnosed diabetes in the population. So why am I really mentioning each one of this? Because these are the indicators that have to be measured to reach that vision for Healthy People 2030. So navigating on, since I started with adults and older adults, so this is another trend in here. Well, not really trend, but more of a picture on the percentage of people age 65 and above. So if you will look at the slide, so the pace of aging is not the same around the world. So regions vary in the size and projected growth of their populations. And basically, most of the oldest countries are in are in Europe. If you will look at the percentage over here, that is a trend that will continue until 2050. So the older population is Asia, and Latin America will more than double between 2015 and 2050, and will also increase in Northern America. But as of right now, if you're just looking at the 2015 data over here, there's a gap. The Northern America is like 15% for people 65 and above, compared to Asia, which is 7.9%. But they are trying to project it in 2050 that Asia will overtake Northern America, specifically some of the countries like Japan and South Korea. So this is the population age 65 and above. So in 2018, 52 million people are 65 and over, and then live in, that's about 16% of the total population. And the older population grew from 3 million in 1900. So if you will look over here, it looks like just 3 million. And then if you will look at 2018 data, which is almost close over here, so that jumped from 3 million to 52 million. So, and then the oldest population, those aged 85 and over, grew from slightly more than 100,000 in 1900 to 7 million in 2018. And in 2020, around 1 in 6 Americans are age 65 and over. And this is projected to rise to 1 in 5 as soon as 2030. So that's 20% by 2030, that there will be a lot of older adults. So life expectancy right now at 65 years for both sexes is 19.6 years. So in men, you have an extra 18.2 years, while in women is 20.8 years, which basically is like women live longer than men. And if you will look at the graph over here for the map of the United States, so for the map of the United States, in case anybody, who wants to settle down in the United States and you're looking for, oh, I want to go to a place that there's younger folks. So basically, if you will look at the lighter color, that will be the areas where there are younger people. So what do you think is the leading cause, top 3 leading causes of death among persons aged 65 and over as of right now? So the first one is actually heart disease. They're still in the #1 spot. The second one is cancer. And the third one is chronic lower respiratory disease. Why am I highlighting the causes of death, especially with older adults? Because that's how we're gonna strategize on what are the things that we can do, what are the things that we can manage on for our own health or for our family members. So this is a national snapshot of older adults on the left side. So that one, for those people living in their houses and not institutionalized, which means that they're not in nursing home, they're not in the hospital, or they're just staying home. Anybody that's staying home at the age of 65 and over, they have fair or poor health. So that's about 22.2%. And then on the right side, some of the snapshots on statistics about diet. most of the people 65 and above, the component scores were highest for whole fruits, total protein foods, and seafood and plant proteins. So in case someone's planning to establish a business, was like, those are the food that older adults are eating right now. Another surprising thing is physical activity. 14% of older adults reported participating in leisure time aerobic and muscle strengthening activities. Can you just, so that's when I look at it, I was like, what? So that's a good number for people to be active and more diverse on their activities, especially with their age. And then for COVID-19 vaccine rate for 65 years and above, the current vaccine rate of COVID here in the United States is 88.5%, but it's for the whole United States. So there are some states who are behind, and there are some states who's really like getting good rate for their vaccine for COVID. And then for flu and pneumonia vaccine, which are common, especially for older adults, so there's 69% in 2018. For screening, especially for male colorectal cancer screening, that's about 78% of older adults go for their cancer screening. And then for women, about 75% of the women go for their mammogram. For cigarette smoking, so 8.5% for non-institutionalized persons age 65 and over. And for persons of non-institutionalized, I use the term non-institutionalized because there are so many older adults now who lived in assisted living or a certain long-term care. So these are the ones who live in the community or in their own homes. So the percentage for obesity for men age 65 to 74 is 41.9%. And for 75 and over is 31.8%. If you will compare, the number of women actually are more obese than men for 65 and 74, and also for 75 and over. So now let's start with health behavior, having done with the statistics and giving an overview after knowing like, oh, this is the current statistics. So how are we going to address their health behavior? So just a definition for health behavior, the one over here, those personal attributes. So this definition is more of the having that behavior as a person. So what are the attributes of a person, which basically includes beliefs, expectations, motives, values, perceptions, and other cognitive elements like personality characteristics, affective and emotional states and traits, overt behavior patterns, actions, and habits that relate to health maintenance, to health restoration, and to health improvement. So that's a definition from Gockman, what is health behavior. But for the other definition of Parkinson, this is more of an actions of individuals, groups, and organizations, as well as those actions, determinants, correlates, and consequences, including social change, policy development, and implementation, improved coping skills, and enhanced quality of life. So these are just like, just to reiterate on the definition that there's one that's focusing on the personal behavior of someone and how it's being defined as an individual. And then a health behavior, the actions of a certain groups or organizations. So for ecological perspectives on health behavior, there are actually 5 principles. So first one, there are multiple levels of influence on health behaviors. So it includes intrapersonal, interpersonal, organizational, community, and public policy levels. They can influence health behaviors, although relative influence may vary by target behavior and context. The second one is environmental contexts are significant determinants of health behaviors. So inclusion of social and physical environment variables is a defining feature of ecological model. The third one is influences on behaviors interact across levels. So interaction of influences means that variables work together. The fourth one is ecological models appear most useful for guiding research and intervention when they are tailored to specific health behaviors. And then the last perspective or the last principle is that the superiority of multi-level interventions over single-level interventions follows from the principle that there are important influences at all levels of influence. So that's basically the ecological perspective on health behavior. Now we're navigating on the theories or the models of individual behavior. So I'll be highlighting 3 individual behavior in here. One is the health belief model. The second one is the theory of reason action or theory of planned behavior. And the third one, which is the trans-theoretical model and stages of change. So for the first one, which is your HBM, which I call an health belief model, this contains, as you can see, several primary components that predict whether and why people will take action to prevent, to detect, or control illness or conditions. So basically on the individual beliefs, over here, so there's perceived susceptibility and severity of disease, perceived benefits, perceived barriers, perceived self-efficacy, and then perceived threat. So basically, you come up with a specific behavior. So for example, COVID vaccine right now. So there are a lot of people researching about COVID vaccine. So why are people hesitant to have the COVID vaccine? So this actually, the health belief model is something that you can apply for it. So probably, for example, perceived benefits. People think like, it will not be beneficial. It's too early. That's what they think or what they perceived. Perceived barriers. They keep on, probably some people are like, because here, COVID vaccine is free to get, while even if it's free, you have to travel, like if you live in a rural area and you need to drive an hour or 2 hours, that's kind of long for them. So that's a barrier, like, oh, that will take too much of my time. Why do I need to go? And then perceived self-efficacy. This is more of like, how do you manage your own self-efficacy is from Bandura's model. So it's also derived from another model before, but this is a common model for individual behavior that's being used for research. The next one is the theory of reason action or theory of planned behavior. So TRA and TPB rests on under the assumption that the best predictor of a behavior is intention, which is determined by attitudes toward and social normative perceptions regarding behavior. So the one that is highlighted at the bottom, like control beliefs, perceived power, and perceived control, these are the ones included. Everything is included in in TPB. And then these 3 over here, they are just in, just remove these 3, and that's the theory of reason action. So basically, this is one of the, when you're talking about if the person really have high intention. So I will discuss most of my research, especially with hearing, health seeking behavior. If you have an intention to go to the doctor, so there's a likelihood that you will actually go to the doctor because they're measuring that outcome. Or if you have an intention to reduce your or to increase your physical activity, so basically you'll probably do some exercises and do make sure that your behavior will be improved. Or if you have an intention to reduce like some of the food that you're eating and go on a specific diet. So if you have an intention, there's a likelihood that you will actually do that specific behavior. So that's how you're using this model. And then the third one is the trans-theoretical model and stages of change. So this actually is about change process that unfolds over time and progressing through a series of stages, as you can see, although frequently not in a linear manner. So sometimes people can, even if there's an arrow, it can go back. So in pre-contemplation phase over here, so it means like a person has no intention to take action within the next 6 months. So it's like nothing at all. And then contemplation phase, that person intends to take action within the next 6 months. So I'm like, oh, I'm contemplating on having this action and have to do it. And then determination, the person is determined or intends to take action within the next 30 days and has taken some behavioral steps about it. And then action is, there's change of work behavior for less than 6 months. Relapse can happen, or maintenance change of work behavior for more than 6 months. And then termination, sometimes like, no temptation to relapse and 100% confidence that you'll stay with that specific behavior. So this is one of my favorite models, especially when you're talking about healthy living or health promotion. So when you're focusing on really have a specific diet and improve your physical activity, most of the people will probably be in pre-contemplation or contemplation phase. Or I always say, joke to my friends, like, oh, I'm still in contemplation phase. I'm aware that I need to lose weight, but I'm not doing anything about it. So when you're applying it for research, the same thing, you have to consider your audience or your participants. Are they ready to make behavioral changes? Because no matter how good your design is, or no matter what type of intervention that is so robust, if you don't consider the stages that they're in and consider this model, they will not likely use that intervention for themselves. So moving on. So that's just, those theories that I mentioned, health belief, the models. So health belief model, the theory of planned behavior, and your stages of change, or trans-theoretical model. So for research scholarship, so I adopted social determinants of health. Your professor mentioned earlier that there are some students from community health, so you probably have an idea what social determinants of health is. So they are basically, the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. So as you can see in these 5 areas or 5 determinants, so you have healthcare access and quality, neighborhood and built environment, social and community context, economic stability, education access, and quality. So one of the qualitative study that I did, is about investigating on the facilitators and barriers influencing healthcare seeking behavior among elderly Filipino women in the United States. So basically, this is a qualitative study, and I did a phenomenological design. So I interviewed 6 elderly women with almost similar characteristics between 75 to 85 years old, but most of them are in their 80s. And there were 4 teams emerge. So what facilitates and influences their healthcare seeking behavior? First one is family support. So if they have family members that keep on telling them, oh, you need to go to the hospital, or you need to have your annual checks, so they are more convinced and encouraged to do that behavior. The second one is faith and cultural understanding. Faith and cultural understanding is you're always thinking, oh, it's a positive one, but sometimes it can be a negative or a barrier for them, because some people might think, oh, the Lord will provide, the Lord will help me, things like that. There's nothing wrong believing in that. The problem is if you don't do any action, because still, even if you have that faith, you still need to do something. You have to go seek for help. You need to go to the doctor. You need to have your labs checked. And then communication and feelings of intimidation. So there are some elderly women who are still challenged to communicate with medical professionals because they're scared that, oh, those doctors might not understand them, or some ways like that. And then one of the biggest thing is having a healthcare insurance and financial concerns. They just go there if it's really like their condition worsens, because they're always concerned, oh, my bill will be this, that will be so expensive. The next one, so as you will look at this model, I actually use the theory of planned behavior. So I was investigating older adults in the community about their health-seeking behavior, specifically for their hearing. So I went to, So for I partner with Cobb Senior Services, and I went to all of the senior centers in Cobb County and screen older adults for their hearing. I have my own audiometry tool, and then check for their hearing. And then when I informed them that they have hearing impairment, so I investigated on, okay, after knowing that you have hearing impairment, what did you do next? And then also, what are the factors, that limit someone for doing that? Although if you will look at the model in here, I also included these three things or three constructs. That's relatedness, autonomy, and competence. That's actually from self-determination theory. I did not mention about it, but it's something that I use. It's a motivational theory for someone on that will influence their behavior. So you can check more of the details in my research. And this is the one that, focusing on, again, the environment, the community, on where the people or older adults live. So we had a notion with my co-author in here that if you have a positive outlook in life, the likelihood that you will have a better quality of life and you have a better health outcomes. And then since COVID hit last year, so we also wrote on the long-term care, COVID-19, what's next? So how are we gonna manage? Because during that time, it was worst time that, especially the home care, not the home care, but the nursing homes were really affected. This is so after that, I kind of navigate on what do I really want to focus on, what type of specific individuals or what specific older adults, because there are so many older adults. So I need to be more specific on my research. So that time, and I have always been interested anything that is neuro related, anything that is about the brain, cognitive impairment. So I focus on dementia or Alzheimer's disease and other related disorders. So this is one of the things that I did. So recognizing healthcare needs among older adults with dementia and with migrant background, because I can relate to those people. Because if they have dementia, where are the issues coming from? Why are there some of the older adults were kind of late being diagnosed? Is it their behavior? Like they don't go to the, they just don't go to the doctor as frequent as they need to be for the migrant, for the people who's migrant in here? Or is it more of like a language barrier? Like it can be, they can be misdiagnosed, or they cannot be detected by healthcare professionals. So that's what I did in this study, because it's still like the behavior of older adults and how professionals or healthcare professionals are addressing them. And then since I'm always interested with, aside from dementia, but also the family caregivers, So what are the issues that they experience when taking care of people with Alzheimer's or dementia? So end of life care decisions for patients with dementia. Over here is my article. It's a case report that we did for a certain family, and they had issues making a decision because their mother did not provide an advance directive. So if you took ethics class already, you know what advance directive can do. It's more of like, if you don't have the capacity to decide, so that's you should have done it earlier, so you'll know what will happen to you when you get to that point, especially with end of life planning. So based on this, the decisions, it's important to have early and ongoing conversations between patients and family members on how they want or what they want to do in case this happen. So they need to be prepared. And then right now, I'm still collecting the data for aging immigrant family caregivers' health, social engagement, and health literacy. So this is for more focused on how is the family caregivers, what's their health status, how we engage them in activities, and what's their health literacy level. So this is more exploratory in nature. And this is funded actually by the Filipino Nurses Association of America. While the second one over here is my ongoing project, which is utilization of social media peer support groups among family caregivers of patients with dementia. So this is like how people behave. So if you're a family caregiver and you're so stressed out, where do you vent? Where do you go seek for support? So this project actually we're investigating on what are the social support groups that most family caregivers aim for. And I have some students with me working on this project that I'll tell you more when I shift or navigate on teaching scholarship. Oops, that's me. So this is actually our nursing. This is the building for Wellstar College. It's a nice building. Actually, they constructed it like a hospital. So it's very nice, very airy. And whenever I go there, it's like, I just enjoy it. So now we're moving on teaching scholarships. So after I talk about my own research now, what do I do as a faculty member to enhance research among students? So basically we use Johns Hopkins evidence-based practice model. So all of the students taking research class need to have an evidence-based practice project. So this is a decision tree that we use. They need to come up with a problem statement, and then the EBP question, determine the need. Okay, determine the need for the EBP project. This is the problem, fit, organizational priorities, and things like that. So I'll show you so these are my nursing students, which actually this picture is very new. This is just today. They presented in the Symposium of Student Scholars. So it's an event every spring and fall, and the students have the opportunity to present their research work or creative activities. So these are all senior nursing students, so they're graduating this December. And this is the project they did. If you will look at the picture, I don't know how small it is. If you will look at some of those colorful things at the middle, we use the Prisma framework for their lit reviews that can help them identify what are the evidences that they need to do. And they have to appraise each article. So when you're appraising article, you're really checking on rigorously how the article is good for, or what's the level of the evidence based on levels 1 to 5, and then the quality rating of A, B, and C. And that's the Johns Hopkins tools that we use. And these are more pictures because all of my students in my research class actually participated in this event. So it's the whole university that's doing the poster presentation. And I had some students did oral presentation as well. Also, I'm part of the first year scholars project. So this is like the website for KSU. And when you go to Wellstar College of Health and Human Services, you will see my name and then the project I'm doing, and you will see the names of the students and the information about the project. So these are first year students, just to let you know. Most of the students are in pre-nursing for their first 2 years. They are not considered nursing students yet. They're in pre-nursing. They have to apply for the nursing program on their third year. And then that's the time that they will start their nursing courses. So they have to be admitted in the nursing program. Even if you're already having your first and second year in the university, like in KSU, it does not assure you that you will be having your nursing program in there, because you have to apply separately. So, and then these are my students. They presented in Georgia Undergraduate Research Conference. And they focused on, as you can see on the topic, that's barriers to medication adherence in HIV positive minorities. So I'm always interested on those minority population and identifying those barriers to, especially with medication adherence, which is really important. Okay, and then application in service. This is the almost my last second to the last slide. So I've been very active with, because I always know that, you know, it's important to be holistic in your approach and be engaged in your community and do a lot of activities. So I was the president of the Filipino Nurses Association of Georgia, and we provided educational programs, and we were the host for the 40th Philippine Nurse, the PNAA, the Philippine Nurses Association of America, in 2019. So I was the host chair during that time. For the 40 years. And then we did a lot of community health services for minorities. So we cater on those people that came in here from, especially refugees. So there are some areas in here that, you know, that we usually do that for our community health services. So for community health services, and I'm focusing on behavior, so we check their glucose, we also check their cholesterol, so some of those things, and then blood pressure as well. And then advocated for culture of health over here. We were invited to speak in, to collaborate with another university and just, you know, tell them what we are doing as the Filipino nurses here in Georgia. And then some member engagement activities that we have, like some social events, you know, promoting healthy lifestyle as well. We have, as you can see in this picture, so we usually have those marathon or, you know, some 5K. And then just some of the things, and that's just it. And I'm done. Thank you. Any questions? So I guess it will be during the open forum. Let me just unshare or stop sharing.
Thank you very much, Dr. Mary Joyce Ramos. Ladies and gentlemen, let us give our resource speaker a virtual round of applause. Thank you for sharing your insights and experiences. Indeed, that was very inspiring, and we do hope that our attendees coming from different places has been enlightened and motivated to continue doing their chosen craft, integrating theories and utilizing the importance of research in their clinical practice. What can you say, Ma'am Dory?
I agree with you, Sir Rolly. Older adults may have complex medical, social, and care needs. And these health behavior theories can be a source of enlightenment to view connections between psychological, social, and physical realms to better understand the health-seeking behaviors of older adults. I myself, as a medical technologist and as a clinical instructor, have noted the importance of research in very crucial to ensure that my practice and what I am teaching to my student is grounded on scientific approach and evidence-based.
Before we entertain questions from the participants, may we call in our first reactor, to give his insights and reactions from the message presented by a resource speaker. Our first reactor is the current officer in charge of the Cavite Provincial Health Office, Dr. Noni John Dalisay. However, he is attending an equally important task at this time. Hence, he will be represented by Dr. Mercado, Medical Officer 3 and Technical Review Board and Institutional Research Committee at the General Emilio Aguinaldo Memorial Hospital in Tres Martires City. Dr. Mercado is a fellow of the Philippine Obstetrical and Gynecological Society Foundation, Incorporated. In addition, our first reactor has Master in Business Administration in Health. Let us give a warm welcome to Dr. Alberto R. Mercado. Good day, Dr. Mercado. Doc, naka-unmute po yata kayo. Naka-mute po yata kayo.
Yan, okay na? Can you hear me?
Yes, Doc. Thank you very much.
First of all, let me thank the faculty of the Cavite State University for having me here as a reactor to the very comprehensive lecture that was given to us by Dr. Ramos. I'm very much appreciative of this opportunity because I will be able to air my sentiments. I've been very emotional regarding the topic because it deals with menopause. Particularly being a gynecologist in my practice, I think menopausal women were not given that much of the attentions. So we know that the Philippine government has given less of the budget as to the Department of Health. And most of the budget have been given to a lot of government institutions, but less for the Department of Health. And when it comes to research regarding the menopausal women, at times it's kind of very hard. So we need to consider that these menopausal women are the vulnerable groups. No? So there are some ethical issues that we need to tackle in considering the research study that we have to give to our menopausal women. And considering the present stage of life of these elder women, parang the ones given to us by Dr. Ramos was very, very ideal considering the situations that the elder people enjoy in the United States, but not entirely. Kumbaga, it's 360 degrees different, no, from the ones that we have here in the Philippines. Now, in the Philippines, as I see that most of these elder women, instead of giving themselves the opportunity to seek whatever they need in their lives, especially to improve their health, they will still give whatever they have, no? Let's say the money, the opportunities for the families, so as to be able to support the daily subsistence of the family as well. So they do not have any access. Sorry. They do not have any access to whatever. No, they do not have any access to the medications, although they have the 20% discount that they enjoy, but they do not know where to get the money in order to finance whatever medications that they must have in order to survive. So that is the real scenario that we have here. So that is kind of a hard-stricken life that these menopausal women enjoy at the moment. They do not enjoy their lives. So whatever they have, whatever money, whatever financial resources, whatever opportunity resources that they have, they will just engage in giving it to the family instead of investing something to their lives, okay? Now we all have to know that the living of elder people in the United States have been subsidized by health insurance, but not definitely here. And we have the health insurance, the PhilHealth insurance, the Portis, etc. But some of the elder people walang bagay na ini-enjoy regarding that. So this is the what you call this, the plea that we as OB/GYN must be considered in order to improve the lives of the elder women that we have here in the Philippines. So it's entirely different, no? So we cannot be ideal considering the lives of menopausal women or elder men that we have here in the Philippines. That's why it's kind of hard to tackle or to tackle or to organize or to concretize any research project considering this most vulnerable group that we have here. Now, so that is the real scenario. So regarding the top 10 causes of death, so one of the, I think it's in top 4, that is tuberculosis. So it's more of the infectious type. So when it is the most infectious type, it becomes very recurrent. So it becomes very degenerative, not to the extent that it will require a lot of a long-term medications, no? So sometimes it's kind of hard to really support financially the present living condition of our elderly people. That is why I'm kind of emotional when we touch on people considering this type of age bracket, which is 60 and above. So I am 56 years old, so 4 years from now, I will be 60 years old. So I will be having my dual citizenship already. Now, on the lighter note, I would like also to thank Dr. Ramos for bringing us the theories on regarding the different theories in order to consider the behavioral dynamics of the elderly populations. So as we all know, when we try to understand behavior, it is multifactorial. They are multifaceted. So we are governed by not only the uniqueness of being an elderly, but there are several factors. There are extraneous factors that are inherent to the external variables that we need to consider in research. There are also internal factors that are intrinsic to the internal factors that we need to consider in research, most particularly the ethical issues that we are facing to the vulnerability of these elderly people. Now, I am glad to share that at present, I am doing my thesis on couple voluntary counseling and testing among pregnant women. So I'm doing it in the same institution where Dr. Noli Dalisay is the officer in charge. So I've been using also the theory of planned behavior, and I was enlightened by Dr. Ramos regarding this particular theory because it's quite very confusing. We know that the theory of planned behavior is a modified version of the theory of reason action because people are governed, no, by their own volitional control. So sometimes, if we consider attitudes and the social norms to be the influential way in order to predict a certain behavioral intention, well, sometimes we're putting ourselves into a mistake. So there are some circumstances, there are some surrounding circumstances, no, circumstantial for that matter, which can affect the decision of the elderly people or some research population for that matter before we come up with a certain behavioral intentions. And I have come across with a study regarding the antenatal attendees. So they have come up with the theory of planned behavior as part of the construct or part of the domains in order to predict a certain behavioral intentions. You know, the result of this is that the theory of planned behavior, such as the constructs of attitudes, the social norms, and the perceived behavioral control, did not actually give a good predictor in the production of the behavioral outcome. So the behavioral intention is different from the behavioral outcome or the actual behavior itself. So the behavioral intention there is to be able to have these antenatal attendees to achieve themselves of doing an HIV testing. So that is the behavioral outcome, which is HIV testing. But it come out that this intention, these intenders, some of the intenders rather, no? So hindi sila magpapatest, but most of them tested. So some of the non-intenders have themselves tested. So it's the other way around, no? So mas maganda sana if most of them who have the intention to do HIV testing, all of them tested. But some of those who are non-takers tested. So ibig sabihin, those predictors, no, such as attitude, social norms, perceived behavioral control, which is under the theory of planned behavior, may not be a good predictor at times regarding the behavioral intention of the person to get themselves tested. So this is part of the outcome of the ones that I got hold of the research article in the theory of bland behavior analysis, considering the antenatal attendees. No, these are pregnant women in Addis Ababa. I think that was in Ethiopia. No, so I'm very glad that Dr. Ramos enlightened us regarding this behavioral behavioral theories, no, in conducting the research. Now, the present setup regarding the research, no, I've been the research coordinator for the past 2 or 3 years for the research committee of the Emilio Aguinaldo Memorial Hospital, Department of Obstetrics and Gynecology. So it's good that Dr. Ramos has that, open-minded students, no, very enthusiastic in doing the research. But what I have experienced is that regarding the residents, no, so sometimes they feel quite, stubborn, hard-headed. No, I've been reminding them a lot regarding the deadlines, no, we have to meet, no, in order to come up with a good research paper. So sometimes it may be the least of their concern, most probably. So I can consider that the enthusiasm may be lacking among them. So it's kind of really hard to really change, no, the attitudes of sometimes of the residents in order to come up with a good research project. So we know very well that the outcomes of the research, no, can be translated into health policy. So there are evidences that we really need to consider in order to come up with a certain health policy, in order to improve the general welfare of all our the recipients or the end users of this particular research outcomes. May time pa ba? Ma'am, do I still have enough time?
Yes, sir.
Yung sa atin naman, no, so regarding the concept, no, so on top of the health behavior, so sometimes the health-seeking behavior, particularly ng elder people, there are barriers. There are really barriers, so many barriers. No, one would be the financial consideration, no, the finance. So that restricted them in order to have that much affordable, the more reasonable, the most things that they need in order to come up with a good decision as to the good intervention or the good diagnosis or the good diagnostic armamentarium that they need to have in order to have or live a healthy living. So yun ang number one talaga, no? So it's more of finance, which is the limiting factor. But of course, there are facilitators that as healthcare providers must be able, the grassroots of all must be that all of us must be in the position, no, to help facilitate, overcome the barriers among the healthy populations that we have. So parang in order to come up with the healthy living among the elders, parang we need to bridge the gap, no, from the grassroots itself, kung saan nagsimula, kung paano nagsimula, what's the origin of the cause of all these problems. So very, very wide, no, yung consider natin before we can come up with the healthy populations among our elderly, no? So ang elderly populations natin would always rely, no, on someone else, on somebody else, in order to have a certain amount of money in order for them to survive their daily living. So I think that's my reaction to the lecture. So I don't have any problems with the health behaviors, the health theories. Of course, you can come up with the good health theories, the good health behaviors, it depends upon the objective. It depends upon the objective of the research, no? So if you are considering the evaluation of the attitude, there are so many theories, no? So in the evaluation of the attitude, so it much more depending on the research objective. Kung anong gusto mong ma-achieve, no? So that will depend on the research objective. I think that will be all. Have I said too much?
Thank you very much, Dr. Mercado, for a very comprehensive reactions and feedback coming up from the message given to us by a resource speaker.
Thank you very much.
My personal reflections from what Dr. Mercado stated is that I do agree with the problems that he is encountering in terms of encouraging our clinical practitioners to involve in research, because we have the same circumstances or experience in the academe. So I think, Doctor, we are sailing in the same boat. But
Yes.
what I'd like most with what you have mentioned is you were very emotional in reiterating the importance of caring and menopausal elders. At the
Yes.
same time, and I hope that with the current universal health law in our country, our legislative and judiciary departments, or department rather, would finally realize that they should come up with a very comprehensive law in terms of protecting our elders, especially the menopausals, not only the menopausals, but the elderly in general. Thank you very
Okay.
much, Dr. Mercado.
Thank you very much too.
Okay, our second reactor is currently working as senior nurse in Cavite Center for Mental Health for almost 20 years. He finished his Bachelor of Science in Nursing at Arellano University, Manila in 1994. He also completed his Master of Arts in Nursing, major in Nursing Service Administration at the University of La Salette, Isabela in 2007. Ladies and gentlemen, let's all welcome Nurse Vanderbilt C. Costa. Good day, sir.
Good morning, ladies and gentlemen, and I would like to congratulate Cavite State University College of Nursing for your successful 6th partnership with Filipino Nursing Diaspora, and most especially to Dr. Mary Dioise Ramos for the enlightenment and for sharing her knowledge and expertise on this matter. I am amazed with what Dr. Ramos discussed on the current national status on U.S. program on health, and I also sympathize with Dr. Mercado on regarding the present condition of the Philippines regarding the programs in particularly in the care of elderly. And I can also talk about only to the center I'm working, and it's very fortunate that
Chicken na lang.
this is high time that
Ano meron tayo?
to discuss on like this.
Ay, wala tayong saan mo bigas. Itlog. Ay. Itim.
Presently, we have programs in Cavite Center Health for our 77 in-house patients, wherein 42% of them belongs to the older adults. We have programs in health promotions like their physical activities, wherein every day our nurses and nursing attendants facilitated exercise for healthy living. And also we are strict on monitoring their diets. We have constant communication with our center's dietitian, though we are so short of the budget for food. We also have weight monitoring to rule out obesity and underweight among our patients. And we have programs for immunization to materialize next week, the COVID-19 vaccine sponsored by our provincial government. And also we have many new atypical medications used in our center that I believe it's good for our patients' improvement. So we lack budgets. We have also, a month ago, we were all diagnostic procedures and hospitalization of our patients are covered at PhilHealth. And that's the improvement I can see will be beneficial for our patients here at the center. Every time I meet students before the pandemic, I always ask for recommendations and suggestions for the improvement of the health conditions and programs for health in our center. And I am encouraging the graduates of Cavite State University. I believe that they can help us in standardizing the health promotions and programs, not only here in Cavite, but worldwide. Or I know that
Sir Van, naka-off po yung audio nyo. Thank you, sir.
I am, yes. Let me continue. I am encouraging the graduates of College of Nursing of Cavite State University to help us standardize the health programs, not only in Cavite, but also worldwide. And as reaction to this, that is my reaction to the topics our speaker has discussed.
Thank you very much, Sir Van, for sharing your thoughts and experiences regarding the care of elderly, particularly in terms of emphasizing the care of the mental health of our elders at CCMH. And of course, on other clients that you have attended, being being the senior nurse at the CMH for a couple of years. Thank you very much, sir.
Okay, thank you, Nurse Van. So at this point, let us now proceed to the open forum. So Rolly, are we ready with the questions?
I believe so. I think I have two questions, but before we will proceed on that, let us hear first the feedback and reactions of our resource speaker from the insights and reactions given to us by the panel of reactors. Dr. Ramos?
Yeah, I mean, it's nice to have the perspective of like what's going on in the Philippines compared to like how it's, how it's been in the United States. Although some of the things, I guess, that's, that happened to both, whether I'm in the United States or you are in the Philippines, all of us were affected by COVID. And COVID take a toll on all of us. So different people have different set of resilience in terms of like how to navigate on those changes. Also, one of the things with the when you're having or using a specific model or a theory for your research, you have to consider what are you trying to measure first, because it's not like, oh, a one size fits all. It's never like that. So you always have to be mindful and plan accordingly. What behavior are you targeting? How do you define the behavior? So even for my own study about health seeking, it's the actual seeking of help to the doctor that I have to define so that I can use whether if they have higher intention, does this result to that behavior? And then at the same time, use another model to go with that, because there are so many models out there, and it's up to the researcher performing the study or investigating on the study, how they can navigate on each specific construct of that. Although what's eye-opening is, I think, of course, I grew up in the Philippines. I've been there almost like, half of my life. I'm aware of the health disparities happening in the United States. Actually, one of the things that I think that will be helpful is for those people who are aware that this is really happening. The question will be, what are you doing with this situation right now? I know a lot of us were like, it depends on your role. Not all of us can change something, but we have our own platform. No matter what it is, you can start a campaign as simple as that. You can pray with regards to things. So, and then as a healthcare professional, especially with Dr. Alberto Mercado and Sir Van, they have direct patient contact with this patient. So after being aware of these issues, what are you doing? What are, I'm pretty sure being aware of this issue, you probably have identified some interventions that you can do for them that will make sure that it will benefit the older adult population to make their life better and to achieve a quality of life no matter where they are or no matter the instance that they have, especially considering the social determinants of health. So thank you for your reactions and appreciated it.
Thank you very much, Dr. Ramos. I think we have 2 questions here addressed to our resource speaker. Let me read this. How can we design behavioral interventions to optimize effective processes that facilitate the adoption and maintenance of positive health behaviors among older adults?
Yep, that's a great question. And as a nurse, I always use the nursing process. So you have to do whole process, you assess. What are the things that you can assess? For your assessment, what are the things that these older adults can do and what are the things that you can do? So you have to assess also the resources available for them and plan accordingly based on that. After you have assessed the situation, of course, you diagnose, right? Probably our nursing students are just like, oh, we're doing the nursing care plan. So you diagnose the main issue, you identify what are the common problems that you may encounter after the assessment, or what are the actual problem, what are the risk problems, or what are some of the other problems that that you identified. And also make sure that your subject or the participants also identify their own problem, because it's not enough that it's only you identify the problem, because they have to identify too that that's a problem for them. And then basically P is the next one, you plan. So based on your planning, what are the aspects that you need to plan? What are the, you're setting your objectives for your plan. Make it SMART, specific, measurable, attainable, realistic, and time-bound. And then you set your intervention based on your objective. And then your intervention should, of course, is it something that they can measure? Is it specific enough? Is it tailored? And of course, after the intervention, you have to evaluate it. Did it work? Is it feasible? Is it acceptable? So you have to test those things. So just going back to nursing process, just like a nurse, hitting it in there.
Thank you very much, Dr. Dr. Ramos. Now we have another questions. Most theories of health behavior focus on conscious psychological processes. Yet, it is apparent that health behavior is highly influenced by non-conscious processes. What are your thoughts on these premises?
I have millions of thoughts with that. So, but again, going back to their own notion of what, because it's the psychological perspective that's available for them. So it's not just like I think Dr. Mercado mentioned about this too, about intrinsic and extrinsic factor that you have to factor in within that. And then it's not just focused on cognitive behavior, or that's there are some social and also other theories that will be applicable. I don't want to always answer theories in there, because just like what I said, there's no one perfect theory that can answer everything. And just like my presentation about how you define the behavior, you have to define the behavior to make a change for that specific notion. So I guess if the question will be more specific on which type to change, or or if it's applicable more on a certain criteria that we're setting in. So, but that's a great question. Whoever think about that?
Thank you very much for the response and for giving your perspective by our resource speaker. Ma'am Dory, do we still have one questions that can be entertained?
Sure. Based on the chat box, these are all positive comments from our participants, and I think they were very satisfied from our resource speaker and reactors. That's why they don't have any question anymore.
That's great. All right. At this level, we will now present an audiovisual presentation of the history, partnership, and collaboration of the Cavite State University College of Nursing with Diaspora Network.
The Filipino Nursing Diaspora Network, FiND, in partnership with Cavite State University College of Nursing, Learning Through Crisis, a look back. Year 2021, a year to inspire, aspire, build, and to share. The Filipino Nursing Diaspora Network, in partnership with Cavite State University Don Severino de las Alas Campus and Don Cavite Philippines College of Nursing, came up to a partnership to leverage education and enhance the learning experience of nurses in the Philippines and around the globe. Filipino Nursing Diaspora, FiND, founded in 2018, the network is based in Sydney, Australia, and is an international professional organization serving the Filipino nurses who are working and living outside of the Philippines. The network was an offshoot from the International Roundtable meeting of Filipino nursing leaders held at the Australian Catholic University last July 16, 2018. The network's mission is actually to enhance the role and value the Filipino nurses across the globe. Cavite State University College of Nursing, the College of Arts and Sciences offered the Bachelor of Science in Nursing program in Cavite State University in school year 2002 to 2003, as per approval of the BOR Resolution number 57, Series of 2001. For indeed, from an insignificant beginning to the college current status as being one of the biggest in the school community, it has grown to be one of the finest among state universities. Now headed by Dr. Evelyn Del Mundo, the college continuously upgrading its quality of education by producing competent nursing graduates, provision of state-of-the-art facilities for instruction and research purposes for students as well as its faculty members, recruitment of highly qualified faculty, and establishing good and strong affiliations with various government, private hospitals, and health centers. Webinar Series Number 1: How do healthcare professionals correct misinformation in social media? With guest speaker Dr. John Robert Bautista, held last August 29, 2020, with GAVSU coordinator to find Ms. Karen Luella Rint, RN Man.
Number one, at least dito sa US, is yung vaccine. So there's always a debate about vaccination here. So they usually encounter vaccine misinformation.
I can say that all of us in the nursing profession were caught off guard to face this pandemic situation. It is very challenging experience for us as nurses in the academe. But I believe that caring is in the blood of the Filipino nurses.
Webinar Series Number 2, Evidence-Based Community Interventions for Diabetes and Hypertension Among Filipino American, Global Implications with guest speaker Dr. Maria Danette Blum, held last February 27, 2021, with GAVSU coordinator to find Ms. Karen Luella Rint, RN Man.
Talk, the other part is global implications. So it's not actually, it's not just the US. This is the data from the International Diabetes Federation, where if you see all that, like all the arrows here really are going up in terms of the number of diabetes.
Webinar Series Number 3, Perils of Predatory Publishing, How Can Nurse Researchers Lead the Way? With guest speaker Dr. Leodora Labrage, RN, DM, CNE, held last April 18, 2021, with GAVSU coordinator to find Mr. Ivan Derek V. Waikoko, RN Man.
The Commission on Higher Education has a list of credible Filipino journals. If you are not aware or if you do not know of other journals where to send your paper, I encourage you, look for credible journals listed by the Commission on Higher Education.
Webinar Series Number 4, The Viral Spread of Vaccine Hesitancy, Building Vaccine Confidence via Empathy and Narratives in the Philippines, with guest speaker Dr. Mark Donald Reynosa, held last June 19, 2021, with GAVSU coordinator to find Mr. Ivan Derek V. Waikoko.
So what can we do to alleviate your fears, your anxiety? So what makes you anxious of not getting the vaccine? And then they will start like, because there were some news about Sinovac, and then there's news about this Pfizer, and then you are hearing a lot of narratives in the Facebook that why are they not giving Pfizer to us? We are paying also our taxes, and so on and so forth.
Webinar Series Number 5, Advancing Advanced Practice Nursing Globally, What Stakeholders Need to Know, with guest speaker Dr. Jasper Talarba, DNP, RN, CCRN, held last August 27, 2021, with GAVSU coordinator to find Mr. Ivan Derek V. Waikoko, RN Man.
It's important to know the different origin or where it started initially. So it was in the 1960s that advanced practice nurses actually started, and the motivation for the creation of advanced practice nurses actually emanated from the lack of physicians and also the rising healthcare costs. So those were the motivations.
Meeting in preparation for November 19 webinar with Dean Evelyn M. Del Mundo, RN, PhD, and Mr. Ivan Derek V. Waikoko, RN Man. Webinar Series Number 6, Understanding Health Behavior and Application of Theories in Research Among Older Adults, with guest speaker Dr. Mary Dioise Ramos, held this day of November 19, 2021, with GAVSU coordinator to find Mr. Ivan Derek V. Waikoko. In a span of 2020 to 2021, we have made this possible. It helped a lot of people, nurses, students, researchers, members of the academe, professors, community, and many more. Achieving in the aim of imparting scientific and up-to-date knowledge in the area of biological, behavioral, social, and medical science, gaining theoretical and practical knowledge that is essential for rendering intelligent and efficient nursing services. Nursing education also aims to contributing to the all-around development of the individual, opening horizons for the growth of a profession, and the nursing education aims at preparing nurses to carry out researches so as to add to the body of knowledge by means of scientific investigations. Reaching and disseminating information all throughout the globe. FiND and CABSUCON partnership has brought awareness on health, behaviors, vaccine hesitancy, evidence-based community interventions, and correct information dissemination on social media. And will continue to make things possible. As the famous saying, develop a passion for learning. If you do, you will never cease to grow, by Anthony D'Angelo. Thank you, and more years of strong partnership to come.
Thank you very much, Sir Ivan, and to our Level 4 student, Ms. Losares, for coming up with this remarkable video presentation.
Okay, so at this level, we will now proceed to the awarding of the certificates of appreciation to our resource speaker and the panel of reactors. May we request our resource speaker and reactors to kindly open your camera to be acknowledged. Thank you. Sir Nurse Van Costa. Doctor, yes. Thank you.
Allow me to read the citation of the certificates. Certificate of appreciation is hereby awarded to Dr. Mary Dioise Ramos for sharing her valuable knowledge as a presenter in the FiND webinar series, Understanding Health Behavior and Application of Theories in Research Among Older Adults, held on 19th November 2021. Signed, Dr. Violeta A. Lopez, President and CEO, and the Dean of the College of Nursing, Cavite State University, Dr. Evelyn M. Del Mundo. Thank you. Thank you very much, Dr. Ramos. The same certificate of appreciation is also awarded to Dr. Alberto Mercado for sharing his valuable knowledge as a reactor in this FiND webinar series entitled Understanding Health Behavior and Application of Theories in Research Among Older Adults, held on this 19th of November 2021. Signed, Dr. Violeta A. Lopez, President and CEO, and the Dean of the College of Nursing of the Cavite State University, Dr. Evelyn M. Del Mundo. Thank you very much, Dr. Mercado, for sparing your time attending our webinar. And finally, another certificate of appreciation is also awarded to Nurse Vanderbilt Costa for sharing his valuable knowledge as a reactor in the FiND webinar series, Understanding Health Behavior and Application of Theories in Research Among Older Adults, held on this 19th of November 2021. Signed, Dr. Violeta A. Lopez, President and CEO, and the Dean of the College of Nursing at Cavite State University, Dr. Evelyn M. Del Mundo. Thank you very much, Sir Van.
Okay, so once again, let us give our resource speaker and our reactors a virtual round of applause. So we are very grateful that despite the busy schedule, they were able to spare time and accepted our invitation in a short notice. Maraming salamat po. And now we are down to the last part of our webinar. Let's hear the video recorded closing remarks all the way from Australia from Dr. Cindy Lay, the Director for Professional Development of the Filipino Nursing Diaspora Network.
Greetings, everyone. I am Dr. Cindy Lee, Director for Professional Development of the Filipino Nursing Diaspora Network. And on behalf of all the officers, directors, and advisors of our network, I would like to express the profound gratitude for today's event that involved our nursing colleagues. A special thank you should be given to our distinguished speaker, Dr. Mary Ramos, who with our reactors, Dr. Noni John Dalisay and Vanderbilt Costa, shared their knowledge and expertise with our attendees. I am sure we all have significant takeaways learned today that we can share with other academics, researchers, clinicians, and practitioners in the community. I will be remiss if I do not acknowledge Dean Evelyn Del Mundo, the CVSU faculty, and other colleagues who work together to make this international webinar a success. To all the attendees and participants, thank you for making time to be involved in this collaborative venture of CVSU and FiND Network as we continuously evolve in our pursuit of excellence and leadership in nursing research and practice. Again, thank you to everyone.
Before we send the evaluation link and present the QR code, may we request our CVSU graduates, students, and College of Nursing Academic Council faculty members to open their camera and join us in singing the Cavite State University hymn.
Okay, so thank you everyone. We appreciate all of you for being here with us. At this stage, we would like to express our gratitude to the following: Cavite State University Administration, headed by our dynamic and past and serious President, University President, Dr. Fernando D. Robles. Then Dr. Camilo A. Pulinga, Officer in Charge of the Office of the Vice President for Administration and Support Services, and the Vice President for Academic Affairs and Research Extension. And of course, to the Filipino Nursing Diaspora Networks, Dr. Violeta Lopez, Dr. Cindy Lay, and Professor Jerome Babate. And lastly, we would like to acknowledge General Emilio Aguinaldo Memorial Hospital Administration, headed by Dr. Noni Jan Dalisay. Sir Rolly?
Also, we would like to express our profound gratitude to Sir Ivan Direct Waikoko and of course to our fourth-year nursing student for coming up with a remarkable video presentation highlighting the milestone of the partnership and collaboration between the CVSU College of Nursing and the Filipino Nursing Diaspora Network. Special thanks once again to Dr. Mercado, Nurse Ban, for gracing this event. Maraming salamat po.
Okay, so we would like to inform everyone that the link to the evaluation form is now in the chat box, and you can also scan the QR code showing on the screen. Kindly accomplish the evaluation form to receive your e-certificate.
Thank you, Ma'am Dory. Also, I have informed by our students that there are questions in the chat box that were not addressed. However, rest assured that we will be answering this, of course, with the help of our resource speaker. And to conclude our program, of course, we would like to thank everyone for sparing your precious time in attending this International Nursing webinar. We do hope that you learned and were able to internalize the significance of understanding health behavior and the application of theories in research among older adults. For photo documentation, we will request our resource speaker, reactors, and the CON Academic Council to open their camera for picture taking. Thank you very much.
Okay, in 3 seconds. Okay, 3, 2, 1, smile. Okay, one more. 1, 2, 3, smile. All right, thank you.
Before we leave, we'd like to announce that starting January 2022, FiND Diaspora Network and CVSU College of Nursing would continue conducting a series of webinars on a quarterly basis.
Okay, so thank you very much. Until the next webinar. Again, this is Teodora Valderrama.
And I am Nurse Rolando Pascual Antonio. We are now signing off. And before leaving the Zoom, let me impart my final thoughts. To our dear attendees and participants, our mental health should be given utmost priority. Once again, thank you for being with us. Have a good day, everyone, and keep safe always. Bye.
Dory, excuse me, can you please post the evaluation link sa chat? Thank you.
Yes, sir. Wait lang po.
All right, congratulations. Congratulations to each and everyone. So let's stay for a while. Thank you, thank you. So we are seeing a lot of congratulatory messages. Thank you.
Ivan, I can share the link.
Link.
Ma'am, just copy and paste it po sa group chat. Sa chat natin. Or Sir Rolly, please check your inbox po. Thank you.
Okay, let me check. Thank you.